So there are a number of different symptoms of the menopause, and these come about as a result of fluctuating hormones in the perimenopause, the lead up to a woman's final period. And then following that, it's generally related to the low levels of estrogen in the body. And because there are hormone receptors all over the body, your heart, brain, stomach, and all kinds of things can be affected. So hot flushes are one of the most common symptoms that you get in menopause, and they probably affect 3 out of 4 women. And they can be associated with sweating, feeling dizzy, feeling slightly sick. We know a lot of you already have problems with pre-existing, sweating excessively, and that might be made a little bit worse during the menopause. So that's something to be made aware of. In addition to the symptoms, there are also many others. So anxiety, mood swings, fatigue, joint pain, constipation, heart palpitations, vaginal dryness, maybe pain with sex. Unfortunately, these can also be quite common symptoms. Not every woman will have symptoms in the menopause, but the vast majority do have some, and it's really difficult to know who's going to be affected. And the length of time the symptoms can last for varies, so it can be maybe a year or so, up to 7 or perhaps even longer. In fact, the average number of years that women suffer is around 7 years, and unfortunately for some women, the symptoms go on for many more years after that too. Along with the symptoms that we discussed relating to the menopause can also affect the health of your heart, your bones and your brain. So we know that as levels of estrogen fall as we age and enter menopause, there's an increased risk of osteoporosis, which is thinning of the bones, of heart disease and also of dementia. However, there are things we can do to help reduce those risks, and HRT, so that's hormone replacement therapy, is one of those things, which we'll talk about in another section. There's also things you can kind of do to help yourself, and that's things like looking at a healthy lifestyle and diet and exercise, which we'll also discuss more.